It's not just about knowing. Even educated women don't come for screening. Get screening. Educated women come late with stage 3 and stage 4 breast cancers because they don't realize the importance of early detection of cancers. I have had patients, highly qualified advocates and whatnot, who've had symptoms, and then there's a huge time lag between the time they come, from the time they have detected the lumps or a difference in the breast to when they're present in the hospital. So I think the main challenge is there's a huge disconnect about what we know, but what we do or follow in our life. And I would say the most important thing about creating awareness about breast cancer is not just about breast cancer and symptoms of breast cancer, but also about stressing on the importance of early detection of cancers, because there's a huge way women would deal with when they are detected with early breast cancers versus late breast cancers. Early breast cancers have a high cure rate, more than 95-96% cure rates, and this gradually drops to less than 20% when detected in stage 4 or when cancer has spread. I think the other problem is also that breast cancer doesn't really create problems. It's just a very silent killer, something like a diabetes or a hypertension. They just have some symptoms in the breast, but they don't have any kind of systemic symptoms. And we still hear that in OPD. I don't feel sick, I don't feel unwell, and you're telling me I have a stage 3 or a stage 4 breast cancer, and how could that be? So I think the key important over here is we have to spread the message that early breast cancers have excellent long-term outcomes, with 20-year survival rates being more than 80%, say, versus a stage 4 breast cancer, which has a survival rate as low as 20% for 5 years. And screening, again, what happens with screening is, because they're completely fine, it's like, if not broken, why fix it? So people don't want to take the time out to come into the hospital. There's a lot of myths and misconceptions about mammogram, exposure to radiation. They think it's very painful to undergo a mammogram, which is actually not true. And the radiation exposure associated with mammogram is very low. So I think maybe with a lot more educational activities, creating more awareness, and also awareness in particular about early detection of cancers, and especially breast cancer, is very important, because from the latest data we have, we know that breast cancer is the most common cancer if you put both men and women together. It's a leading cause of cancer in India, and it is said that breast cancer is the most common cause for death in the women in the age group of 35 to 54 years. So you're talking about young women who are at the peak of their lives, careers, whatever, when the family needs them the most, and that is the time when a lot of time is lost. Women are diagnosed with stage 3 and 4, and we lose these women. These women will die with advanced breast cancers. It is a challenge, and education is really not a guarantee that somebody is aware and somebody is going to come in. So I would say just creating awareness for everybody is important.
Thanks, Dr. Poovamma. So as you mentioned, education is not the guarantee. In fact, that's why our focus this time has been on the urban settings, because we really feel they really need to understand. Sometimes education actually creates a hindrance in mind.